Welcome back, America. Earlier this week, you may have seen a headline that Virginia Governor Glenn Youngkin wants to spend $230 million on a behavioral health crisis. I applaud this, and he's joining me this morning to discuss what he's doing. Good morning, Governor. Welcome back to the Hugh Hewitt Show.
Good morning, Hugh. So great to be with you, and Merry Christmas.
Merry Christmas to you. And I want to spend all of our short period of time on this $230 million request because I think it is a absolutely urgent priority for every governor. What's it all about, Governor? What moved you to make the ask?
Well, we know we are in a behavioral health crisis across Virginia and across America. And Hugh, it touches everybody. I don't know anyone who hasn't had a family member or a close friend who hasn't had that horrific phone call about a suicide or someone who's had a behavioral health crisis. And we got to get on this because the biggest gap we have is the services that are available versus this huge surge in need across the Commonwealth. And I can't help but look back at the horrific murders in Charlottesville and Chesapeake, and not know that our behavioral health system just must do better. So we're calling for a substantial investment in capacity, in school-based resources, in telehealth, so that students at universities and in high schools can reach out and get help the day they need it. A substantial investment in mobile crisis teams and crisis receiving centers, so that we can react immediately, so that those Virginians who need help can get it. We're investing substantially in personnel to make sure that we're increasing our pipeline of psychiatrists and psychiatric nurses and nurse practitioners, in staffing at our state hospitals, and in post-crisis facilities, so that those Virginians who are ready to step into their recovery have an appropriate place to go. Our system is being overwhelmed. This is our moment to step up and meet that challenge, and this is for the long-term health of the Commonwealth of Virginia. This is going to be a 3-year transformation effort. We can't get it all done in 1 year, but we are taking a bold, big step to fundamentally change the way that we are addressing behavioral health in Virginia.
So, Governor, how did you arrive at the specifics in the plan? Glenn Youngkin didn't go into the basement and do some internet research. How did you come up with, here's where we want to spend the money and here's what we've got to get, particularly the personnel pipeline?
Hugh, this has been a priority from the day we started on January 15th, and we've had a fabulous team working on this with involvement from thousands of industry participants. But at the end of the day, the best practice models across the country really are clear. The Arizona model is really good, and I'm very happy to use them as a benchmark as to what our capacity should be. We also have had pilot programs running in our schools with in-school staffing. We piloted our telemedicine and telehealth capabilities across a number of our universities this past year. And so we're taking best practices from across the country, pilots that have worked in Virginia, and scaling them. And we've been working with some of the best minds across the country and across Virginia. This is a well-structured plan, and this first step is so important because we can't wait. So it's the right help right now, and we're getting moving.
So Governor, it's a big umbrella, and under that are tragedies like the University of Virginia student who was so troubled and took the lives of his classmates. And then you have K through 12 crises. They're all very different, but they're all under this umbrella. Is there enough differentiation between the particular set of problems you're dealing with and the resource allocation to make sense?
There is, with the clear statement that we have to build capacity across all of it. One of the biggest challenges that we do have is that the services and capabilities for our youth are in the worst condition. Virginia was just ranked 47th in the nation for youth behavioral health capabilities, and that is not where we are going to be. We are not going to be there. And so I am concerned about the entire spectrum of services, but particularly for those services for our young people. And what we're seeing, of course, with our young people is just an extraordinary uptick in suicide, in overdose, and in the scourge of fentanyl. I mean, we have record levels of overdoses in the Commonwealth, and 76% of them are from fentanyl. And so my extraordinary wife, Suzanne, and our Attorney General, Jason Miyares, launched a program 2 weeks ago called One Pill Can Kill. And it is a broad-reaching communication program to help our young people understand that one pill will kill you. And we have to make sure that people understand that the fentanyl that is pouring over our border, our open border in Texas and New Mexico and Arizona and California, is already in Virginia and is taking lives. This is at the top of our list, and boy, Hugh, it is heartbreaking, and we're getting to work.
It is heartbreaking. 20 seconds, Governor. Do you have Democratic support for this?
We do. This is not a partisan issue. This is a Virginia issue. This is an America issue, and we're going to lock arms and get this done.
Godspeed. Go save some lives in 2023. Thank you, Governor Youngkin. Merry Christmas to the entire Youngkin family. I appreciate you joining me.